Hello and welcome to our next episode of Live and On Call. My name is Allie. Today I will be your host talking about therapeutic Botox treatment. So if this is your first time joining us, Live and On Call is a live stream conversation where we bring Lake Charles Memorial physicians, in this case a nurse practitioner as well, right to your computer, your tablet, your phone, wherever you are watching this video. We will start with a discussion with our guests, and then we'll leave some time for questions. Hence the live and on call. Physician and the nurse practitioner that we're speaking to today will be live and all to answer your questions. During the chat, if you feel like you have a question or you want to know a little bit more about something that they have talked about, feel free to drop them in the comments below. If you would like it to say anonymous, that's totally fine. And you can send us a direct message and we will be checking those during this video as well. So we're all here to learn. Don't be afraid about questions. I will be asking many questions about this topic. And I hope you enjoy today's episode. If you want to learn more or find more of these videos where we bring some other physicians to your smartphones, we have some other topics in our videos or on our website about cancer prevention, healthy eating, and so much more. So let's get today started. We are going to be speaking to Dr. Seth Billiodeaux and Nurse Practitioner Kathryn Istre, both with Lake Charles Memorial Health System. And let's see. Dr. Billiodeaux and Kathryn, you are live and on call.
Great, it's good here.
Thanks for joining us. Before we get kicked off, I do want to learn a little bit about you guys, a little bit about your background. Tell us what led you to this point in your career as a physician, as a nurse practitioner.
Well, good. Well, thank you again for having us. I am an anesthesiologist by specialty, and then I did a special training in a fellowship, pain management. That's where we specialize in interventional procedures, small, minimally invasive procedures to address problems of spinal and joint pain.
Awesome. And Kathryn?
I've been a nurse practitioner for a few years now. My background is in adult ICU, NICU. I worked as a registered nurse for about 10 years prior to getting my nurse practitioner. My goal has always been to help improve people's quality of life. And so working for interventional pain management allows me to do that. And I'm very happy here.
So you both kind of touched on this, but tell me a little bit about the patients that you see coming through your doors. What would lead a patient to your office?
Well, our practice is pain management. It's a interventional based practice where we focus on procedures. And so we see a wide range of realm of conditions, mainly spinal pain, neck pain, back pain. We also see non-surgical joint pain, hips and knees and joints. And then we also address other medical conditions, post-herpetic neuralgia, and then migraines. And so it's definitely part of the specialty dealing with pain. And most of what I do does deal with spinal and joint issues, but we really have to be prepared to address every facet of pain. And migraines is a significant part, and it can be very time consuming for primary care physicians or neurologists. And so since there is an interventional component with Botox, it has become a part of our specialty.
Great. Yeah, that is definitely something that people deal with regularly is really painful migraines that may keep them home from work or from going to their kids' activities or just like Kathryn said, decreasing their quality of life. So we're really glad to hear from you guys and what your advice is for this. So guys, like we said, we're talking about therapeutic Botox today. And I think a lot of people think about Botox in the way that's like this magic potion injection that stops aging and smooths lines and makes you look younger and more attractive. But you guys are using it to treat real conditions that people are decreasing people's quality of life. So I know you mentioned migraines, but what other kind of conditions can you treat Botox for therapeutically?
Well, that's a good question. And we'd like to emphasize and have patients and the public understand that Botox is used for a lot more than just cosmetic purposes. And it is more than just migraine headaches. Not a lot of people know about its use for migraine headaches, but even fewer people realize that the other applications. It's a part of my practice I really enjoy is the therapeutic aspect, treating muscle spasticity after strokes or congenital condition that someone's born with, like cerebral palsy, or maybe a neurological disease like multiple sclerosis, or tremors, essential tremors. And so it can really have a broad therapeutic aspect. Someone has a very tight muscle contracture. There's a lot of functional disability. They can't move their arms, or they can't lift their head to bring a spoon to their mouth. And so we can really improve someone's mobility and quality of life, even if it's just small goals like getting out of a wheelchair and transferring onto a bed, having that limb out of the way, or just straightening that limb so it's not so noticeable, and causing just a subconscious psychological effect. So, and a lot of spasticities are associated with pain. I've had patients come in with forearm spasticities and their wrists hurt and they come in for their wrist pain, but we look at their arm, it's a contracture, they've had a stroke about a year ago. And so we can use Botox to straighten out the muscles, and their pain usually gets a lot better.
And I bet they would have, I bet a lot of people are surprised when they hear you say, well, we could treat this with Botox.
Right.
So tell me a little bit about how this works. Like, what's the science behind it? Why do you choose Botox to treat it this way?
Botox is an amazing drug in the fact that it has such a long duration of action. Instead of taking a pill by mouth every day, or maybe a large surgery that a patient's not able to undergo, or not willing to accept the risks, Botox can last for 3, some applications 6 months. And it's a very minimally invasive procedure, very tiny needles. And so it can be done really easily outpatient in an office. Sometimes we do have to use image guidance, because some muscles are very fine and we have to very precisely see what we're doing. And outside of what I use to treat the spasticities and the painful conditions with Botox, there's a much broader aspect, overactive bladder, or strabismus, where patients' eyes aren't aligned. I don't do the ophthalmology aspects or the urology aspects, but most of Botox is with spasticities, and there's a wide range of conditions that can be treated.
So tell me about, using this for migraine relief. Is it just you find a couple of spaces that are typically more painful in the patient, or how does that go?
So there's a paradigm. The research was based off of 2 sessions of Botox treatment, which is about a 6-month period of time. And what they found was that patients got significant relief with their frequency and duration of migraines. But we do address 7 muscle groups. Some of them are facial muscle groups, and so there can be some aesthetic effects. And, I have aesthetic training as well. But we address muscles in the neck and in the head to help control these migraines. And like Dr. Billiodeaux had mentioned, these treatments last about 12 weeks. Usually about week 10, we start seeing some increase in recurrence of symptoms, but overall significant improvement.
And so I guess depending on the level of pain, does that mean there may be more units injected, or is there a correlation with that?
So normally we use a protocol. It's 5 units per injection site. There's a total of 31 injection sites in these muscle groups. The grand total is 31 injections, but each site is 5 units.
Gotcha. And will this help everybody? Is this an option for anybody who has chronic migraines, or if I have headaches regularly and I come see you guys, is there some kind of criteria I need to meet?
So the criteria for chronic migraine is at least 15 headache days a month, 8 of those considered migraines, lasting more than 4 hours if left untreated. Most of these people will have activity intolerance. You're missing things that you had planned, like you had mentioned, a kid's soccer game, a birthday party. These things are debilitating for these patients. moderate to severe in intensity. It doesn't necessarily have to be unilateral pain, but usually they'll also have side effects with these migraines, such as nausea, vomiting, sensitivity to light and sound. And we look at all of those things to see if you qualify as someone who has chronic migraines. The other aspect of it is preventive treatment with other medications. Usually for Botox, you have to have failed previous treatment with a couple of oral medications, sometimes injectable medications, like the newer medications, the CGRP medications. That would be Ajovy, Amavig, Emgality, those types of drugs. And some people do find benefit with that, but sometimes it's not enough. And Botox is an option.
Gotcha. Just a reminder to those of you who are viewing today, feel free to drop any questions in the comments below, and we'll get to them in just a little while. But if you have any questions about treating migraines, about headaches, you could go ahead and put them in the comments or send us a message, and we'll get to them just a little bit. As we move through some of these questions I have, I wanted to kind of switch gears, talking a little bit about hyperhidrosis and excessive sweating and treating that. I mean, we live in Southwest Louisiana. When are we not sweating, right? So how are you addressing that?
Well, we're looking for primarily axillary hyperhidrosis in the armpits. A lot of people, that's what they describe their nervous sweats. They go for presentation, their dark shirt looks very wet, it's embarrassing, they're self-conscious about it. We're not trying to stop people from sweating, because that's a body function that helps us cool and maintain our normal temperature. But we want the sweating that's socially inconvenient. And that's primarily the axillary. But also there's conditions where palmar hyperhidrosis, where they go to shake someone's hand and it's sweaty, it's awkward. They want to shake anyone's hands. Everyone thinks they're rude because they're not shaking them. So it can be a very socially awkward and debilitating condition. And so that's what we want to improve. We're not trying to stop sweating everywhere in the body. And some people, hyperhidrosis can affect their feet really bad. Their shoes smell really bad. And that can also be a social awkward thing to deal with. And so there's applications for the feet, but the areas that are most social concern is what we try to address.
Gotcha. And so does the injection truly stop all sweating, or is it just kind of cut it down?
I think that
in the injection spot, I guess.
You still have some sweating, but overall it's significantly reduced in comparison to prior to these injections.
I think that's even a little conservative.
Yeah.
I'll have to say, I'll admit, I've had it myself, and my experience is you stop sweating.
Gotcha.
But yes, to be conservative, when we're discussing patients, we're counseling them, there is some breakthrough sweating. But it's pretty shocking how profound the difference is.
Wow. So are there any concerns that anyone should look out for? Maybe any kind of adverse reactions or side effects that someone would want to deter someone from not seeking out a treatment like this?
Most of the side effects that we see are localized reactions to the actual injection. So redness, bruising at the injection site. You may have a little wheal, a little bump that forms where the injection was given. Usually that goes away within 30 minutes to an hour or two. But overall, those are the main things that we see. Other risks of Botox, especially with the facial muscle groups, are eyelid and eyebrow ptosis. Some of these things can be corrected with additional Botox treatment to help to lift the eyebrow, and eye drops to help to open the eyelid. But these are pretty uncommon adverse effects.
Gotcha. Is there any population of people who just should avoid Botox treatment? I don't know of any conditions or anything like that. If not, that's okay. I just wanted to ask that.
Some patients with neuromuscular conditions, extreme weakness, myasthenia gravis, that sort of thing, it can be contraindicated for patients with those conditions, because you're delivering a toxin that's going to stop that release of acetylcholine and muscle movement. But overall, most patients are fine to have these injections.
Awesome. So again, if you have any questions, I see one question here in the comments, but we'll get to some more too. If you have any, please feel free to type them in. I wanted to ask, is Botox a curative treatment? Will, let's say I'm having chronic migraines, can I expect after so many treatments that my migraines are less for the long term, or is this something that you have to kind of keep doing?
Yeah, well, we counsel our patients that migraine headaches is a chronic condition, like hypertension or diabetes. It's something we define curing more an aspect, is it controlled? We don't expect it to completely go away. It's something that they'll probably need treatment more or less the rest of their life, although there's evidence in the older population above 60 that migraine headaches do tend to dissipate. And so that is our goal. We can get them to a point in time where, whether it's their stressor in life has abated, that they can control on a regular treatment. And the way we define control is you can take medications very seldomly and they're effective. The patients that we come in to see, they say, I'm on my triptan medications. My insurance only covers 9 per month, which there's a medical reason, because overuse of triptan medications can cause medication-induced headaches, and they become dependent upon it. And when they're not using them, it's kind of like a cat chasing its tail, or like withdrawal from coffee. If you're not taking the medication, then your migraine headaches become more frequent. So in other words, we want to limit the medication use so that when they do need them, it is effective. And so that's what Botox does. It helps reduce the severity, reduce the frequency, and they can use triptan medications a few times a month, and they're effective.
Great. Well, I'm going to go ahead and get to this question that we have. Someone asked, how can Botox be utilized to treat symptoms associated with TMJ?
So it can be shown to help symptoms of TMJ. I know that for the most part, this can be done here in the masseter muscle. These injections are given, and it helps to relax this muscle. Most of the time, symptoms of TMJ are caused from clenching and grinding your teeth during the night or during the day. We always advise that you see a dentist first and make sure that that is looked at. Sometimes splinting can help, but when all of these other conservative options are not helpful, then we can consider Botox as an option. Now, right now, Botox is not FDA approved to treat TMJ. We do use this in application just off-label because it has been shown to be beneficial. But as of right now, there's no insurance coverage for this because it's not FDA approved.
Yeah, so we know anecdotally from our experience and small case studies that there's obvious benefit. I do believe there's a pretty large study being funded, and we are anxious about the results with that, and that should help coverage with insurance.
Yeah. I know that what I'm hearing you guys say a lot is just that there are people dealing with these inconveniences and debilitating pain that is really affecting their quality of life, and that we don't have to live like that. We have options, and that we can see you guys and have a better quality of life and not miss our kids' soccer game or, birthday party or whatever. But I guess I want to ask you one more question. If nobody else has anything in the comments, that's okay. But does someone need any kind of referral to come see you, or can they just call and make an appointment?
A referral would be helpful, but they can just call our office. It's pretty straightforward. We don't need a extensive medical history from the primary care physician, but it's certainly helpful. It would probably speed up the process, but if they pick with the phone, call our office and say, hey, how the migraine headaches can I be seen and evaluated, then we'll get them right in.
That is good to know. All right. Well, if nobody else has any questions, I will we'll just wrap this up. If there's anything else that you guys wanted to add, any other conditions that you treat, you kind of touched on at the beginning, Dr. Billiodeaux, but if there's anything else you'd wanted to share.
Yeah, cervical dystonia is a condition that we see pretty often. We receive a lot of referrals for, and that's a condition where the neck muscles or the tone is unequal, and so a patient might have their head posture be altered, and it causes pain. It could be caused from a traumatic condition or genetic condition, and so those we have to carefully evaluate. There are some different risks associated with the neck, but and that's where image guidance usually comes in, ultrasound, and so in my practice, I do Botox throughout the body, lower extremity, upper extremity, neck. I think I've done every indication, but I've rely on ultrasound a lot. A lot of practice was founded upon a nerve conduction or a muscle finder but with my training with ultrasound, I can actually see the muscles that we're injecting and see which part of the muscle is hypertrophied more than others. And so not only can we get the exact muscle, we can find what part of the muscle is best to inject it in. And oftentimes the muscles we think that are controlling the spasticity or the condition, it's not the muscles. When we go look at under ultrasound, we can move the limbs and we can see in real time what's going on, and then we can selectively apply the dose.
Yeah, it kind of gives you an inside look into the body and what's going on, so that you can inject it once. Got it. So, well, thank you guys so much for joining us and for sharing your advice with us. We really appreciate it. For those of you viewing, the Memorial Interventional Spine Clinic is located at the Lake Charles Memorial Hospital in Oak Park. It's kind of on the backside in Suite 110. And we have the contact information on the screen here if you are interested in making an appointment. So thank you guys so much. We appreciate it.
Okay, thank you. Our pleasure.
And we will see you guys next time for more topics. See you later.
Okay, bye.
Bye-bye.